I started as a speech pathology major and quickly realized that was not the best fit for me. But you have to take an intro to audiology course as a speech pathology major. I had never heard of audiology before, didn't know what it was, but that course just kind of opened my eyes to this niche of a profession that is certainly needed and widely used, and so I found it very interesting. Audiologist, we are able to see pediatric patients all the way through geriatric patients. Personally, since I worked at the VA prior to this, I was mainly geriatric focused. We typically are just evaluating hearing loss and then going from there as far as any treatments, fitting for hearing aids, any type of kind of oral rehabilitation. It's very patient-led and focused, but that's kind of our typical practice. I think the biggest misconception is that hearing aids are this big, old-time kind of bulky device, that they're, not aesthetically pleasing, and that they can maybe act more as like an amplifier. They're not very, fine-tuned or programmed specifically to a patient, that it's kind of a one-size-fits-all. And that's very much, not the case. We're certainly fitting a patient appropriate for their needs and only their needs, and that's, the goal. Hearing loss is generally a very gradual thing, so it's like by the time you truly feel like you're noticing it's impacting you or causing struggle, it's just kind of been decreasing this whole time. So it's certainly something we always advise and encourage patients to get checked out sooner rather than later. Even if that's a monitoring situation, at least you kind of know where you're at as a baseline, and going from there versus, waiting too long and trying to address it at that point. I always want patients to feel heard and listened to, and so I'm always trying to display that empathy when we're talking through their struggles or their history. And so I think it just kind of starts with those types of conversations and interactions, and from there you usually get some more openness and smiles, giggles, and it usually turns out great.